gentleman, Bob Rathod, is in March of 2019 being sentenced to 12 years of prison for healthcare fraud and some identity theft. And what you can see if you read this is that this gentleman, he's got to pay $1 million restitution, etc. But in 2013 here, he was previously sentenced to 4 years in prison and excluded from participating in Medicare and Medicaid related to a kickback scheme and a healthcare fraud scheme. And the importance of this is that, as it says, he was released from prison back in, 2015 or 16, I think it was, and he was able to go out in the world and generate yet another fraud scheme, which he was sentenced to prison for in 2019. This gentleman was my employer, my first job out of PA school in 2008. And so I met Rathod, and he, if you can believe it, actually had some prior convictions in the state of Michigan and was slapped on the hand and was allowed to go out in the world and generate yet another fraud scheme, which he was sentenced to prison for in 2013, got out of prison yet again and generated yet another fraud scheme and went to prison in 2019. And let's just hope for everyone's sake he doesn't get out. So we're going to talk about the importance of you guys validating your work, your employers, your preceptor sites, and kind of being in tune to the people that are governing you in your employment and telling you, setting policies and procedures, and also very in tune to your own ethics and morals and how you practice from day to day. So I included this letter here. Pretty much what you'll see is that I was a PA student. I graduated from the University of Wisconsin-Madison School of Pharmacy in 2006 with a bachelor's in pharmacology and toxicology. I'm a Wisconsin girl, born and raised. I moved to Michigan and graduated from PA school in 2008 and immediately took a job with Bob Rathod, operating one of his family practice clinics. And I thought it was such a great deal. I met Rathod through two of my preceptors who were also PAs during my schooling. And this letter here is a letter from the prosecuting attorney. It goes on for 4 slides, so you can read it at your leisure, but I wanted to kind of validate for you that what I'm telling you is true. And I was introduced to Rathod through these 2 co-defendants of mine. They were later arrested and went to prison for healthcare fraud and receiving kickbacks. And they said, you know what, I knew him through school. I knew him through the program. I was doing rotations with them. And they said, this guy has a great opportunity for you. Check him out. We really like him. I think you'd be great for his practice. And so subsequently, I finished my final family practice rotation while a student. It was approved with Bob Rathod at one of his companies, a clinic owned and operated by Bob Rathod. And then I subsequently took the job with him. Well, unbeknownst to me, Rathod had this history of healthcare fraud, was slapped on the hand, allowed to go back out into practice and operate these companies and this new scheme that I became wrapped up in. So in 2012, I was arrested, indicted on charges of healthcare fraud. And ultimately, there were other providers in that indictment. Ultimately, I was pled guilty to receiving a healthcare kickback. I received a felony conviction, and I was sentenced to 6 months of home arrest and 2 years probation. I moved down to Northwest Indiana at that time to be closer to family and my now husband. I stayed with him. And during that time, through the whole process, I subsequently lost my Michigan PA. My Michigan PA license was suspended, and I had to go through the process of regaining that along with all of my credentials. So it's been a very, very long journey. I have a lot of insight, And we will go through things that you need to know to protect yourself and to be in tune so that you avoid some of the mistakes that I made. I get a lot of people as I do these lectures that say, oh, it could never happen to me, I'm in the hospital, or it would never happen to me because I'm not that naive. Well, let me tell you, these fraudsters are out there, and they prey on people that are highly educated, highly intelligent, no criminal histories, and they get you into these schemes and they manipulate you, they lie to you, they deceive you, and it's kind of in the gray area sometimes. So you think you're okay and then you're not. And I'm also going to show you cases where, yes, people in hospitals have been impacted. So we need to be aware when we practice. This letter, you can see here that it was written by Mr. Beckery, and he says, you know, she was a student in her PA program, placed into rotation with these 2 physician assistants. They had been taking these kickback arrangements. And then she met Rathod while she was in school. And she had a legitimate bonus payment arrangement based on productivity, but he wasn't abiding by that agreement and was paying me differently. He was ultimately paying me directly for my referrals. This page just says, you know, I was a help to the government. I was cooperative. And then immediately after I was convicted in 2013, I said, hey, what can I do? I want to help educate other PAs. And I went out and I actually started speaking with the prosecutor 2 weeks after my conviction. And so we did a few lectures together, and then I kind of took it over on my own. And I've actually developed my own company because it's something that's very close to me and I'm very passionate about it. You can see here too, I was excluded from Medicare and Medicaid and had significant licensing consequences. This letter was for an administrative law judge in 2015 in the process of me trying to get reinstated with the state of Michigan. I got suspended for 6 months and a day, which meant I had to go back and ask them to reinstate me. So the prosecuting attorney who tried me actually said, look, State of Michigan Licensing Board, she has significant mitigating circumstances. I want you to be aware of these, and I want you to consider that when you're looking at reinstating her, that she really does deserve this because she came into some, what does he say here, an unfortunate placement into a veritable snake pit of bad practitioners as part of the training program and while initially employed. Okay, so there you kind of have a little bit of history. That letter was huge in my getting licensed in the state of Michigan, or the state of Illinois, because the prosecutor saw that and was kind of like, wow, there are some mitigating factors here we need to take into consideration. Here's the objectives for our discussion. Again, this is something that I have taken. I speak to PA programs in Michigan, and I speak at conferences, and this is something that we could have an hour-long conversation on each of these. I love to talk. I love to share my story. And so I've given you all the resources you need. If you ever want to come back and look at anything, or if we cover it too quickly, it's here for you to review. There's some great links you can click on here and check things out. So disclosures, this information is not here to be a legal advice for you. It's not here to be anything more than information to help guide you. You should always, this information has not been reviewed by an attorney. I do work with an attorney who does some speaking with me, but this information is not, you know, solid gold. So I encourage you verify everything for yourself. This lecture is being used to set fulfilled probation terms from the state of Illinois Medical Board. I actually haven't gotten approval for it, but you guys, I just got my PA license. The consent order was August 18th in Illinois. I just got the license like last week. And so I just asked them for approval to do this lecture and have it count for a probation requirement. Pretty much they saw what I was doing in the speaking. Michigan had set up probation terms for me to include speaking engagements because they said, wow, you're really touching on stuff here that we agree is under discussed. We want you to do it. And Illinois pretty much mirrored that. So I had this lecture set up, I think a couple months ago, maybe even a few months ago. It's something I wanted to do. Obviously, last year I was scheduled to speak, so it's something close to my heart. I'm a professional. I'm a member with MAPA, Illinois Academy, and the American Academy. I also do own my own business. I've never made any money with my business. I think simply because I've been doing these lectures, without charge. I enjoy them, and it's for a good cause. So, define and understand these key terms. These are things you need to be able to understand. And while they seem simple, they get a little tricky because there's some gray areas, something that is criminal versus not criminal. And sometimes people think they're okay and they're not. So Medicare and Medicaid defines fraud as knowingly submitting or causing to be submitted false claims, and also knowingly or soliciting or offering to receive any sort of payments in exchange for anything in terms of referrals or services. So this is something that seems pretty clear cut, but we'll go on to show obviously that there are cases that are not. I'm not going to go through all these examples with you because you can read that on your own. And again, these are pretty clear cut. Now we get into the area though of abuse, and there can be a fine line between fraud and abuse. Any practice that's not consistent with the goals of providing patients with services that are medically necessary, meeting professional recognized standards, and being within range of fair prices. And this is something that is a little questionable, because some people will say, well, how do I know what fair pricing is? How do I know what standards of professional care are? And it's interesting because what may be a standard of care in the state of Michigan may not necessarily be a standard of care or part of the Illinois Public Health Code. And so those are things that you guys have to be in tune to really focus on in the state that you're practicing in. Understanding your charges and how your company comes up with these charges. And are they in line with the Illinois Workers' Comp fee schedule or in line with the Center for Medicaid schedule? Because ultimately you as a provider are selecting, the charges to correspond to your services. And so ultimately you're responsible for those. Some people say, I was going to speak at a conference for one of the hospitals this spring, and it was a hospital. So a lot of the mid-level, as they say, nurse practitioners and the PAs, they were like giving feedback that they didn't feel it applied to them in any way because billing isn't really anything they're involved with. Well, I say to that, you're not necessarily, except that you're the provider and you're marking the level of care. And just because there's a billing aspect that you may not be in tune to, you should be in tune to it. So that's something we can talk about later on. That's kind of billing is a whole separate topic, and there's courses on that. But I want to make you aware that it is an area of abuse. So upcoding is a huge thing in terms of abusing, and it can turn into fraudulent if it becomes persistent. Knowing how to justify your level of care. Are you billing 99213 visits versus 99214 visits? If you don't know what I'm talking about, you've got some research you should do. It's something that you're saying, this is the code that corresponds to the services I provided. EMR is a huge thing because EMR, people are going through and checking physical exam, for example. Did you actually physically examine all the things that you're marking when you're checking off your EMR boxes? Review a systems, review systems. I had a brain lapse for a minute. It's Friday. You have to consider, did you actually ask all those things that you're checking off in that review of systems? And if you're not, then you really need to reflect on what you're documenting happened during that exam. And I'll give you some examples of why that's critical later on. But upcoding is huge. And there are people that are in tune to this and watching people that are outliers in the system. So fraud and abuse, again, both of these areas can put you at significant criminal risk, but also civil liabilities. And we'll talk more about that. Waste is just incurring unnecessary costs. Deficient management, practices, systems, controls, misusing resources. These are things that they really put a burden on the system, and somebody who's not in tune to the services they're providing and creating excess waste in the healthcare system can lead to abusing and can lead to fraud. So it's important to be in tune with yourself and your practice and see where you're at. So ordering excessive diagnostic tests, these pharmacies that constantly send out medication to our elderly patients on auto refills. The patient hasn't requested them. I myself get a refill reminder all the time. And it's like, I don't need that. I don't need that. I've told you I don't need that. And it's not even time for it being due. So they're just sending this stuff out and they're charging for it. It's really a waste in the system. And then overutilizing procedures, testing, someone's always watching you. So the other thing to be very in tune to is the Federal False Claims Act. Anybody who knowingly submits a claim or causes a claim to be submitted that is fraudulent is in violation. They don't have to show that you had an intent to defraud, which is huge on a lot of these statute and laws, if you will, that we talk about, because they just have to show that it happened. They don't have to show that you knew. They don't have to show that you actually intended or knew you were receiving a kickback. All they have to show is that you took the money, for example. And there's civil and monetary penalties that can be affiliated with all these things, even if it's something you could never be charged criminally for whatever reason. So this also includes the whistleblower action. If you're part of a team and you see something going on and you're very uneasy about it and you think it may be some fraud, you need to report it. And we'll talk about where you can do that later on. You're protected essentially. And if the government does go after a company, you actually can receive payment on the proceeds that they collect. So something to note there. So claims not rendered, not supported by documentation, falsifying documentation. You know, I consider myself a fairly young PA in the sense of the word, because I was out of practice for a short time. I was in practice for about 4 years, and then I've been just regaining my credentials the last several years. And the thing is that in that short time, I've seen a lot of people falsify documents. If it didn't happen, you know, then you shouldn't be putting it on a note. Very important. For whatever reason, at times people think it's okay and they'll write things down maybe to cover themselves, or they get scared if there's a pending investigation. You can never, ever do that. And I promise you, there's people watching you at every level. We've had instances I'm aware of where FBI agents have gone into exam rooms, especially with the narcotics, stings that they're doing. The DEA agents will be there and they sit in the exam room and they are trying to see what you're doing. Are you doing your exam? Are you documenting that exam? How are you, discussing things with the patient? Is your plan consistent with what's written? Are you just handing out narcotics without sufficient documentation, or actually doing what you said was documented? So I always tell people, practice as if you have an FBI agent or DEA agent sitting at your exam table, or on the other end, of the computer screen, I guess we should say nowadays, because that's critical. There could be somebody there. And there's also people watching. If you're an outlier, are you someone who's always billing a higher level charge? The insurance companies watch those outliers. And so they can come after you and say, wait a minute, you're always doing this skin biopsy. You're a family practitioner. You are always doing this. You're always billing this high amount. That's way without the norm. Why? You know that they're monitoring you in terms of narcotic usage. The DEA can say, hey, this state of Illinois, these are the top 5 prescribers of narcotics and specific ones. And they know that and they're watching. So it's no different with some of the claims. And you need to be in tune to that and make sure that nothing you're doing is false. And then the federal anti-kickback statute. Again, you cannot knowingly or willfully offer to pay, solicit, or receive any sort of money, incentive, rewards, anything for referrals to generate business. So this is something that is a federal law, but then there's also similar regulations in many of the states. And so you can be held accountable at a federal level, at a state level, with your private insurance payers, with your federal insurance payers. It's a big deal. And so even if you ask or offer and the payment's never actually made, that can be a violation as well. So what are we talking about? Free rent, free urine drug screen cups, extensive compensation for medical directorship, consultancies. That's huge. Hey, we're going to pay you to oversee this business here, and we're going to pay you $10,000 a month. Well, is that legitimate? Are you even somebody who's qualified to supervise or oversee? That's something you need to take into consideration that we don't always think about because it's not directly a referral per se. And let's scream it on the rooftop here. So here's some terms I